Hi, I'm Michael. I'm a registered dietitian working in oncology, and today we're talking about a fear that circulates on cancer forums and quietly does real harm. The idea that IV nutrition, what we call TPN, or a feeding tube, will feed the tumor and make the cancer grow faster. I've seen patients and families refuse recommended nutrition support because of it, even while losing dangerous amounts of weight. I want to give you the honest verdict right at the top. Feeding a person with cancer does not accelerate their cancer. What does harm outcomes is malnutrition. So if this fear has been sitting with you, let's take it apart carefully, because getting this right matters. Let me be fair, because I understand where the fear comes from. The logic sounds airtight. Tumors use nutrients, so feeding the patient must feed the tumor. It's the same intuition behind sugar feeds cancer and the idea that you can starve the disease with diet. When you're frightened and looking for control, withholding food can feel like fighting back. I don't think anyone who worries about this is foolish. But the biology works differently than the intuition, and acting on the intuition can cost the patient dearly. Here's what the evidence actually shows. There is no clinical evidence that feeding a cancer patient by mouth, tube, or vein speeds up tumor growth in people. What is well established is the opposite risk. Weight loss and muscle wasting are tied to worse treatment tolerance, more complications, lower quality of life, and shorter survival. That's why the major clinical nutrition societies, the ones that write the guidelines your care team follows, build their recommendations around preventing malnutrition. Undernutrition is the documented threat, not feeding. And here's why. Feeds the tumor, gets the biology backward. A tumor takes what it needs from the body, whether or not you eat. When you withhold nutrition, the tumor doesn't shrink, the patient does. The body starts breaking down its own muscle and fat to keep going, and that wasting is exactly what makes cancer harder to treat. Nutrition support exists to protect the patient's strength and lean body mass so they can get through treatment. It's aimed at protecting you, not at starving a tumor that can't be starved this way. Let me put my clinic hat on for a moment, because I want to be balanced. None of this means every patient needs TPN or a feeding tube. These are real medical tools with real trade-offs, and we reserve them for specific situations: a blocked or non-functioning gut, severe swallowing problems, or an extended stretch where someone simply can't eat enough. TPN in particular carries its own risks and is used only when the gut can't be. The decision belongs to the medical team, weighing benefit against burden and your own goals. My point is simply that the decision should rest on clinical judgment, not on a myth. So where does that leave you practically? If you or someone you love is losing weight during treatment, treat that as the emergency, not the feeding. Ask your oncology team for a referral to a registered dietitian, track weight and intake, and flag rapid loss early. And please, don't refuse recommended nutrition support out of the fear that it feeds the tumor, because that fear is not supported by the evidence. Trading a real danger, malnutrition, for a false one is a heartbreaking mistake I'd love to help you avoid. So here's the bottom line, one more time, clearly. Feeding does not accelerate cancer. Malnutrition does harm outcomes. Nutrition support, when your team recommends it, is there to protect the patient. If this helped, share it with someone wrestling with this exact decision. Because calm, accurate information is one of the kindest things we can pass along. Take care of yourself, be gentle with your choices, and I'll see you in the next one.